All right, this video is going to cover past medical history. This area will cover major events, ongoing medical problems, preventative care, social history, nutrition history, and developmental history. So please keep in mind that this area, this section, you have to do it every time, okay? Like I said a little bit earlier, you have to do this section every single time with every patient. You have to review them. I don't care if they've been here 1 day, 2 days ago, a month ago, a year ago. Please go over it because we need to make sure it's updated all the time, okay? So the first section of the past medical history is major events. You're gonna go in there and you're gonna ask the patient, hey, what are the major events? Basically, these are usually surgeries, right? So with surgeries, you ask them like, sometimes I rattle off a few. I say tonsils, appendix, gallbladder, hysterectomy, spinal fusion, things of that sort. Please make sure you put those in there, okay? Type them out. If they can give you a year, that would be great as well, okay? The second one is ongoing medical problems. Hey, do you have any ongoing health issues? Okay, generally things that they've been diagnosed with, okay? And again, you can rattle off a few. Say, do you have blood pressure, hypertension, diabetes, cholesterol, gout, heart disease, whatever it may be. And again, you could type those things out. You could type out, diabetes, blood pressure, cholesterol, heart disease, and things of that sort. Now remember, a lot of patients might say, oh, I have nothing. And this is something that happens. They'll give you a bunch of medications, say, I don't have any health issues. But what I would recommend you do is say, hey, well, you told me about these meds. What are you using those for? And that usually jogs their memory, and they'll say, oh, yeah, you know what? Yeah, I take this medication for this and this and that. And then vice versa. If they give you a bunch of health issues or things they've been diagnosed with, and they say, I'm not on any medication, say, oh, well, are you taking any medications for these, conditions? And sometimes, again, that might jog their memory and say, oh, you know what? I do take Synthroid for low thyroid or something like that. And I do have low thyroid. And then that's something that you would update and add to their profile, okay? Preventative care is usually vaccines, and usually within, I usually say the last couple of years. Hey, have you had any vaccine in the last couple of years? You can rattle off a few. Have you had any flu, COVID, shingles, pneumonia, RSV, any of those, and you go ahead and put those in there if they've had any. Other preventative care items that you may want to ask about are, for example, for females above 40, mammograms are recommended. For males above 50, colonoscopies are recommended. So things like that, if they volunteered, if you have time to kind of quickly ask, by all means, go ahead, ask, and put it in there. So you can type that in there for sure. And then social history at very minimally, with social history, there's 3 items that you want to ask for, okay? And those would be smoking, drinking, and drugs. Hey, do you use any tobacco products? Because some people chew, right? So the way it's worded is important. Do you use any tobacco products? No, I don't, but no tobacco use. If they do smoke or chew, the vast majority of people are smokers. If they do smoke, ask how much do they smoke and how long they smoke for. Oh, I've been smoking a pack a day for the last 15 years. 1 pack a day, per day, 1 ppd, cigarette use, tobacco use daily for 15 years. Alcohol is ETOH. You can use that acronym. And again, that's as a side note. Please don't make up your own acronyms. I've had people put in POS. That's not a proper acronym, for positive. NEG is not an acronym for negative. Just type it out. Or put no tobacco. Is for ethyl alcohol, which is the alcohol that's in alcoholic drinks, right? So you're welcome to go ahead and use those acronyms as long as they're acceptable. They're AMA, approved. If someone read them, another office read them, or someone, medical professional read them, they'd understand what you're saying, right? So it's important just not to make things up like that, okay? So that's with tobacco. With alcohol, again, ETOH. No ETOH, no ETOH. If they do drink, say, hey, how often do you drink? Okay. The one thing I'd say about that is if it's someone that says, hey, I drink every day, I would like you to have a follow-up question of, okay, oh, you drink daily? How much do you drink a day? I've had someone tell me, hey, I drink a 12 pack a day. You know, that's significant. And, you know, and that may play a role in the way that we're treating the patient for that day for the symptoms that they're coming in for. So it's important to note that as well. And finally, drugs, illicit drugs. So type in no illicit drugs if they don't do illicit, meaning illegal drugs, heroin, cocaine, meth, things like that. So, and if they do, and they have patients that will come in and say, oh, you know, I do use cocaine, I do use heroin, and put that in there. Now, a couple, one item or a couple items that kind of come up in this section are, whenever you ask about smoking, sometimes people say, no, I don't smoke tobacco, but I vape. So you could go ahead and put in, or vapes. How often? I vape daily. Put vape daily. And another one that comes up is marijuana, especially when you ask about drugs. Now with marijuana, again, it's legal, but definitely ask, say, how often do you use marijuana? And they might say daily. That's fine. They use twice a week. That's fine. So type it in there. Marijuana used 2 times weekly, and you can go ahead and do that. Okay. The third one is nutritional history. That's generally for children. I want to go back really quick to preventative care on vaccines. We talked about vaccines. For little kids, I want you to ask if the patient is up to date UTD on their childhood vaccinations. Most of the time they are. There are a few parents that will tell you, I don't vaccinate my children. Again, we don't want to be judgmental. It's not our job. We're just basically recording facts. Child not vaccinated. And again, that goes into our management and treatment of the patient. Okay? Now with nutrition history, again, generally it's for children. Do they eat well? Do they sleep well? Do they have regular bowel movements? You can ask those. Those are generally some of the questions you ask. I'm not necessarily worried about it as an adult. Now, unless the adult tells you, oh, I have anorexia, I have bulimia, you can ask, hey, how's your eating habits? They might say, you know, I don't eat, or I eat too much, or I, you know, things like that. But that's rare. But again, that's something to keep at the back of your mind, okay? Developmental history is generally for children, and you ask, hey mom, hey dad, hey guardian, will they have full-term birth or a preemie? Preemie is anyone considered before 37 weeks and under 5.5 pounds. If they say any of those, they're considered premature. And I want you to put how premature. So mom might say, oh, they were born at 35 weeks and 2 days. Put 35 weeks and 2 days of birth. Another question I like to follow up with is any developmental delays. Maybe they didn't meet milestones. They had delayed walking, delayed speaking, and things like that. If there's none, just put no developmental delays. That's a good thing to add in there. And that should cover all of them. Okay?